therapist assistant who graduated from Clarkson College. I have been in practice 8 years now, and I feel like I've gained many experiences that will help me when earning a degree online. I have the time management skills and organization skills needed in order to set priorities and set goals and to meet those deadlines and course expectations. During my time as a home health care worker, I also feel like I developed the communication skills necessary for me to complete an online degree because I needed to communicate with my therapist from a distance both effectively and efficiently. As for my weaknesses, I can be very timid in new situations, and especially so until I feel comfortable with them. I tend to avoid confrontation, whether I'm at home or at work. But overall, I hope that you guys can see many of my strengths during the rest of this video essay. I am HEART. This acronym describes me because I am hardworking, ethical, attentive, reliable, and a team player. When I have accomplished my caseload, I offer to assist my fellow PT staff with theirs. I have turned down assignments that were outside supervisory requirements or the scope of a PTA. I pay attention to details that patients provide which are pertinent to their plan of care, and I strive to always be present when I tell a patient that I will be there or to perform my tests and measures accurately. Most of all, I work as a team player because the patient benefits from this the most. I am HEART. Bring to you today my husband Dave. He's going to join me on screen today, and Dave actually just recently herniated his discs, both L5 and S1, so he gets to be my guinea pig today. Along with the L5 and S1 disc herniation, Dave, you actually had radiating pain down your right side on the posterior thigh, along with a left lateral shift of his lumbar spine. So what we're going to demonstrate today is actually going through his plan of care from kind of the beginning of what we worked on with him following the therapist's recommendations. So come along with us for the next activity. Dave, some of the first activities that we're going to work on for you is decreasing your pain as well as correcting your posture. We also have a goal for strengthening your core muscles to help support your back. But before we can start on strengthening your core muscles, we want to work on your postural alignment to get you into better position. So we're strengthening you in the correct posture to begin with. So right now what we're going to work on is a self-guided exercise that you can do at home in order to correct the leaning that you've been doing since herniating your discs. The goal for this is to help centralize your pain, decrease your pain, and improve your postural alignment right now. And then after that, I'm going to instruct you on how to do a little bit of trunk extension. That also helps with decreasing your pain and helping to centralize your pain, as well as just getting you into good posture as well. So let's begin with that.
What should I do?
Okay, I'm going to go ahead and demonstrate this for you as we go, and then I'll have you try it out after that, okay?
Okay.
So, to begin with, you're going to need to stand next to a wall, or door frame, corner, whatever you can find that you can lean against. You want to be somewhat close to it. Have your arm up on the wall. For you, you might be a little bit more comfortable with your shoulder and elbow about height here. Put your hand on the other hip, close to the pelvis height here, and what you're going to be doing is gliding your hips over to the wall or cupboard, whatever you're leaning against. Make sure it's sturdy, okay? I want you to do that glide 5 times, and after the 5th one, then I want you to come back to a standing position, take a little break, and then we're going to do another 5, okay? Now, because you're actually leaning to the left, I do want your left shoulder to be the one on the wall.
Okay.
Okay, so go ahead and come on over and let's try that out.
You want me here first?
Correct.
Is this how far I should be standing up?
That is looking good. As you're doing it, make sure that you are not twisting your back. Keep your hips and shoulders in good alignment there. Good. Take a break. Excellent. How did that feel?
Good.
Now, I want you to try to come up into a more extended position. So trying to come up onto your arms and on the elbows where your shoulders come up a little bit, but keep your hips down on the mat table here. How is the pain now that you're sitting up a little bit more?
It's good. It feels good.
Good. Is the pain still radiating down your leg? Has it improved?
No, actually, it's not going down as far. It's more right around my back.
Okay, good. So this position here is helping with your pain, and I want you to work on this each day about 2 or 3 times, and I want you to do this for 30 to 60 seconds at a time when you're holding that position, and do about 5 to 10 repetitions each time that you do it. So I would love to design a course about stroke rehab across the continuum of care. It would include a short review about strokes and then focus on therapy beginning in the acute care setting and progressing to the post-acute setting, home care, and then outpatient PT. The goal is for multidisciplinary teamwork throughout the continuum for a patient to reach their optimal recovery level at discharge. This chart breaks down the class into a broad timeline and includes off-site learning experiences in each care settings, as well as an experience where not only therapy staff are present, but nurses, physicians, occupational therapy, speech therapy are all present to discuss the goals of care per discipline and ideas of how to work together in order to achieve those outcomes. I'm big on hands-on learning. I would have short lectures interspersed with activities like case scenarios and small groups and simulating intervention ideas throughout the course. In order to assess the learning, I would use quizzes. I would use the time during case scenarios to have verbal questions with my students, as well as to use teach-back method, which is a method that I have come to learn to love over the years, which has people teach back all the information that you've been giving them in their own words and in their own phrases, or having them to teach others in order to assess that they've actually learned what you've been going over. Since becoming a clinical instructor, I have come to appreciate even more so the education that I received from Clarkson College. Clarkson sets high standards and expectations for their programs and their students alike. I am proud of Clarkson for taking the next step in advancing the PTA degree to a bachelor's degree, and I look forward to seeing the positive effects that this will have on our profession as a whole.